Okay, class. In this video, we are going to study the diseases that are related to the stomach. The function of the stomach mainly focuses on the digestive function. The stomach can receive and transform the food and water. The stomach prefers moisture, dislike dryness. The stomach also in charge or manage the movement of downwards. They need to move something downwards. If this function has been affected, the patient will the patient will present as the qi rebellion, such as nausea, vomiting. So the function of the stomach need to keep something moving downwards. That's also why in the constipation that are related to the large intestine, sometimes we also use the points on the stomach meridian because one of the function of the stomach can move something downwards. That's the constipation. You're going to move the stool downwards. The spleen and the stomach are coupled meridian, and the coupled organs. These are also the origin of the most important organs of the acquired qi and blood. This is also where the qi and blood origins. This is where does the blood come from? The middle jaw receives the qi. Where does the qi come from? Also the middle jaw from the stomach, spleen and stomach. The diseases that are related to the stomach may due to the improper diet. This also sometimes related to the diseases that are related to the small intestine and large intestine. Improper diet can be like unhygiene diet, or eat too much, or hungry, excess hunger, or cold and hot of the food, too cold, too hot, or spicy food, or these different factors in the diet. It also may relate to such as the alcohol intake. It also may result in stomach problems. The common symptoms the patient may feel is the abdominal pain. This abdominal pain will present in the upper abdomen, nausea, vomiting, vomiting with food, vomiting with blood, or diarrhea with blood. The diarrhea with blood, this blood won't be red in color. Then in this situation, the patient may present as the black stool. This black stool is very typical. We say like the tar. So if you don't remember, go back to the diagnostics in the observation. When we observe the stool, we have the image. What kinds of stool is the internal bleeding? The most common reason, the food retention. The patient may present as fullness of the abdomen, abdominal fullness, pain, dislike pressure, vomiting, nausea, sometimes sour taste in the mouth. The patient may accompany with diarrhea, a thick, greasy coating, slippery pulse. The most possible causes may be excess drinking, excess food intake, or poor digestive function. The treatment principles are going to promote the digestion. Acupuncture only, purging method, no moxibustion. So these are the principles. The food retention, because the food retention is a kind of excess syndrome. The food, the excess. You can focus on the Rome meridian, foot yummy meridian, stomach around points, such as zone 12, the stomach, the the meeting points of four organs. Room 11. Stomach 21. Stomach 36. Pericardium 6. Spleen 4. Stomach 44. The stomach coldness syndrome. The stomach coldness, the patient will present as cold pain. This pain, the patient prefer warmth, prefer pressure. The patient may be nausea or vomiting with clear fluid. In the cold weather, it will be worse. In hot weather, it can relieve. White slippery coating. The pulse can be deep, slow, wiry, or tense. The treatment begin to warm the middle jaw, expel the coldness. You can use the combination of acupuncture and Moxibustion, even manipulation technique. You will focus on the foot Yang meridian, foot Tai meridian, and the back su points, along points, stomach 21, stomach 36, stomach spleen 4, spleen 6, room 12, bladder 20, bladder 21. Focus on the stomach and the spleen. These are coupled meridian. Coupled organs. Coupled organs. Why we can use stomach Yangqiu. Yangqiu is to check the C cleft points of the stomach. You also can use these points. These two group of points, mostly they either related to the spleen or stomach, or they are the local points. So these are also the functions of acupoints. They have the local function. You also have distal function. We can choose the local points that are related to the disease. We also can choose distal points according to the meridians, according to the relationship between the meridians and the disease. Stomach heat syndrome. Stomach heat syndrome, the patient may present as heat pain, burning sensation, sour taste in the mouth. The patient may present as excess hunger, thirsty, prefer drinking cold, bad smelly mouth smell, constipation. The gum may be red and swollen, or even bleeding, gum bleeding, red tongue, yellow coating, and the pulse may be large, surging, slippery, and rapid. In the treatment, we will focus on clearing the stomach heat. We're going to use acupuncture, no Moxibustion. We're going to use the reducing technique. We're going to focus on the hand and foot Yang meridian because the foot Yang meridian is the stomach meridian. So we're going to focus on the Yang meridian because this syndrome is also a heat syndrome. The Yang meridian we have mentioned in the discussion in the lung diseases. The Yang meridian has a lot of qi and blood. So we can use the points on the Yang meridian to relieve the heat. Why the excess heat? We're going to focus on the qi. What's the relationship between the heat and the qi? Whenever we talk about the heat, excess heat, I always talk about the qi. The qi in the Yang meridian or in the Tai Yang meridian. What's the relationship between the heat and the qi? Actually written in the classic. So excess qi is fire, which is the heat. So that's why when we see a patient presented with excess heat, we try to relieve the qi. This qi can be pathological qi. Excess qi is fire. That's why for the heat, we're going to reduce the qi. That's also why we focus on the Yang meridian. From the Yang meridian, that's because it related to the stomach organ. It's also because of the characteristics of the meridian, of the Yang meridian. For the stomach insufficiency, the patient may present as abdominal pain as well, nausea, vomiting. The patient may present as hunger, but this hunger, the patient doesn't want to eat. So they can feel hungry, but they don't want to eat. Dry mouth, dry tongue, and constipation or dry stool, scanty urine, red tongue with less fluid, less coating or even no coating, a rapid thin pulse, tonifying, or you also can nourish the yin. You can use acupuncture, less moxibustion. You can use the tonifying technique. When we say less moxibustion, which means you can use a moxibustion. We're going to focus on still the same hand Yang and foot Yang meridian. The stomach alarm points, large intestine 4, realm 12, stomach 21, stomach 36, pericardium 6, stomach 4, realm 23. Actual point 12, actual point 13. Now here's the question. Why we use pericardium 6? Where does the theory come from for pericardium 6? Pericardium 6 can be used anything related to the chest and the heart. Stomach, chest, and heart. So it describes that stomach, chest, and heart. We can use pericardium 6. Anything related to the stomach and abdomen, we can use stomach 36. Anything related to the lower back, the waist, we can use bladder 40. Anything related to the head and the neck, we can use lung 7. Anything related to the face and the mouth, we can use large intestine 4. Where do these principles come from? These come from the connecting points, the function of different connecting points also come from the commander points, or the 4 summary or commander summary points or commander points. This is related to the spleen. The spleen, the main function of the spleen will be the transforming and transporting. Transport the food and fluid, transform the food and fluid into the qi that we need for the body. The spleen prefers dryness, dislike moisture. The spleen also can regulate the qi. The spleen can that's from the transporting function. They transport something we need to the lung. The lung can disperse the qi. The waist goes to the stomach, goes downwards. That's the function of the spleen. The spleen also governs the blood, but this blood only the lower part of the body, low extremities, or in the muscles. So when the spleen becomes dysfunction, patient may present as diseases that are related to the digestive system, such as the poor appetite, abdominal fullness, diarrhea, or bleeding. This bleeding mostly in the lower part of the body, bleeding in the stool, diarrhea with bleeding, or bloody stool, excess bleeding in the menstruation. The patient also may present as fatigue, heavy sensation of the body, edema. This is the swollen feeling, swollen sensation. Doesn't have to be. It can be edema, but it doesn't have to be edema. That's the distending feeling. The patient also may feel weakness in the extremities. The reason is because of one of the function of the spleen. If the spleen becomes dysfunction, we will have the excess dampness in the body. The dampness accumulation will result in the heavy sensation. The dampness. Spleen qi deficiency. The spleen qi deficiency may from the qi deficiency, so the patient may present as any symptoms that are related to the qi deficiency. Spleen qi deficiency. The patient also may present as poor appetite, abdominal fullness, diarrhea, especially chronic diarrhea, or loose stool, pale facial complexion, fatigue, reluctant to talk, pale tongue or white coating, weak, forceless pulse. Because of the spleen qi, the spleen governs the rising of qi. So if the spleen qi deficiency, it can cause the dislocation of organs. The dislocation can be chronic diarrhea. The stool goes too quick. The stool doesn't stay in the large intestine. It can be bleeding in the large intestine. It can be relax of the rectums. It can be a relapse of the internal organs, such as the stomach or the uterus. The qi governs, controls the blood. The qi limits the blood in the vessels. The spleen deficiency, because of spleen is the root of the acquired. So the spleen deficiency also may result in bleeding because of the qi doesn't limit the blood in the vessels. It can be the bleeding in the stool. It can be bleeding, excess bleeding during the menstruation. It also can be the bleeding in the muscles. During the treatments, we're going to tonify the middle jaw. We're going to use the combination of acupuncture and moxibustion. Tonify or reinforcing techniques. We're going to focus on the foot tai yin meridian, foot tai yang meridian, and related back-through points. Spleen 3, spleen 6, stomach 36, stomach 40, stomach 23, stomach 21, 皮枢 and 胃腧. These are the back-through points of spleen and stomach. Stomach 40, 丰隆. We have mentioned that the 丰隆is very good for the phlegm, to clearing the phlegm. Spleen qi deficiency will result in excess dampness. Once the dampness accumulates in different areas, we need to think about the relationship between the dampness and the phlegm. We also have mentioned in the diseases that are related to the lung. The spleen is the root cause of the phlegm. Where does the phlegm come from? The phlegm comes from the spleen. It stores in the lung. So the lung is the container of the phlegm, but the spleen is the original area where the phlegm comes from. That's why we use stomach 40. If this patient accompanied with qi thinking, we can add round 6, round 4. Do 20, we can use moxibustion. Do 20, the qi thinking. Even the internal organs sinking, the dislocation of the internal organs, we can use 220. This is the distal treatment. We use some points on top of the head to treat something below. If this patient accompanied with bleeding due to qi deficiency, we're going to add spleen 1, spleen 10, spleen 17. We also use Moxibustion. Spleen 17, this is the meeting point of the blood. Spleen 10, from the name, 血海, 血 is the blood, 海 the sea of the blood. Spleen 1 is the Jingwei points of the spleen meridian. Spleen qi deficiency, further down, it can develop into spleen yang deficiency. We have mentioned that the actual qi is the fire. When you see from this point of view, too much qi is the fire, which means if you don't have enough qi, it's the coldness, the fire or the heat. The opposite side of the fire is the coldness. So the deficiency, the qi deficiency, may develop into yang deficiency. And then the patient may present as something coldness, such as still the abdominal pain, but this pain, the patient prefer warmth, prefer pressure, and the diarrhea, loose stool, diarrhea, also the leukorrhea. In a lady, they may present as excess leukorrhea, especially the white and clear leukorrhea. Cold extremities, or even edema, a pale tongue, white coating, deep, slow, forceless pulse. These are due to the yang deficiency. In the treatment, we're going to tonify the spleen yang. We're going to use the combination of acupuncture and Moxibustion. Reinforcing technique, we're going to focus on the foot tai yang, foot tai yin spleen meridian, foot yang ming stomach meridian. So basically, we're going to focus on the spleen and the stomach. We're also going to we also can focus on the transport points because of deficiency. Spleen 3, spleen 6, stomach 36, stomach 40, room 4, bladder 20, bladder 21, bladder 23. For spleen yang deficiency, why we use bladder 23? That's because bladder 23 is kidney. Kidney is where the root, the original yang stores. That's the meaning of the prescription. So for spleen yang deficiency, the internal coldness, we can focus on the spleen and stomach as well as the kidney. The last syndrome in the spleen, damp heat accumulation in the spleen. The treatment principles will be clearing dampness and heat. As we mentioned previously, the spleen doesn't like moisture, it likes dryness. So the damp heat, the dampness may affect the spleen function. The patient may present as poor appetite, nausea, vomiting, thirsty, but this thirsty, the patient doesn't want to drink because of the heat. The heat will consume the body fat while the patient will present as thirsty, but the patient doesn't want to. Heavy sensation in the head, sticky stool, yellow eyes, yellow skin, yellow greasy coating, sultry pulse, sultry rapid pulse. We can clear the dampness. We can use acupuncture. We can use Moxibustion because of the heat. In the treatments, we're going to focus on the foot tai yin, put 厥音 such as spleen 3, spleen 5, spleen 6, spleen 9, level 3, level 13, level 14, stomach 36, GB 34. These are only the examples for your treatments. When you compare the 脏腑 differentiation from this therapeutics and the diagnostics you have studied previously, you will see some of these syndromes are similar, some of the syndromes are different. The reason is because we only use these as an example. And in future, you also may find different syndromes according to the patient. So these syndromes, in our practice, we do not define the syndrome before seeing the patients. Our syndromes will based on the symptoms, the presentations of the patient, we based on the pathogenesis of the patient, and then we conclude to the syndrome. These syndromes we only use as an example to help us to understand how to apply the treatment principles, how to apply specific techniques and specific points. Thank you for your attention.